This is an introduction to what to do when a patient arrives to the operating room. So, why the operating room? Well, situations during labor can have the potential or need for surgical delivery. Twin deliveries require a double setup, a vaginal birth delivery in the operating suite with the potential backup of a surgical delivery. Also, unfavorable fetal tracing or fetal intolerance of labor indicate a need for expedited or urgent surgical delivery. Fetal stressors or distress, such as infections, lack of variability as seen in chorioamnionitis, may require urgent or emergent surgical delivery. Maternal distress or intolerance, such as bleeding, eclampsia, HELP syndrome, or abruption, are some examples that require urgent or emergent surgical delivery. Your ability to prepare the patient for the surgical delivery can help get us to the point of incision quickly. Therefore, your familiarity of the operating room can be hugely impactful for a good outcome. The operating room can be intimidating, if anything, just for the sheer number of machines spread throughout the room. But we can overcome this by keeping to the basics of patient care. First, transfer the patient onto the operating table. Second, make sure anesthesia monitor and machine are turned on, and supplemental oxygen is applied to the patient by a mask. Third, promptly apply patient monitors and make sure that the 3-minute blood pressure interval is selected from the menu on the monitor. Number 4, position the patient with a slight left-sided tilt so that she can be ready for the procedure. Make sure you have a strap on the patient's lap to ensure that she is secured to the bed. Number 5, perform a timeout to confirm surgical and anesthesia consents are signed and validated by surgical team and anesthesiologists. Number 6, crash C-section kits or surgical equipment must be set up by whoever is available in the room at the time. Do not wait for the surgical team to arrive. And number 7, make sure the baby resuscitation station is ready. The next slide will give you a brief tour of the anesthesia monitors, machine, and the bed. These steps should get you through the essential part to allow the surgery to commence. This is the obstetric operating suite. On entry, head straight to the anesthesia machine. While you have your colleagues put the patient onto the operating table, let's turn on the anesthesia monitors. This green light here indicates that the machine is already on, is on standby mode. So go up here and touch the screen on standby. The screen will awaken. If you look over here, the anesthesia machine is actually on the off position. So go ahead and turn it on. It will power itself on and go through internal testing. That's all you need to do right now. On this machine, over on the left side, there are some knobs over here. It says air and oxygen. You can see it's going through the self-test. The oxygen outlet is right here. So if you need the patient to be on oxygen, you go down to the drawer down below. First drawer indicates there's oxygen and flashlight, blood pressure cuffs. So here are your oxygen masks. Grab one out, place on a patient, connect the inlet to the oxygen outlet right here, and turn on this oxygen to 10 liters. Next, we want to place the monitors on the patient. First thing we want to put on is probably just the easiest thing. This is the pulse oximeter. place it on patient's finger. And next, reach for a blood pressure cuff. If the patient does not have a blood pressure cuff, let's put one on. There's a little cubby here with all the kind of sizes. There should be one that will fit our patient. If not, there may be more inside these drawers. Top drawer. Put the blood pressure cuff on the patient. And next, come to the machine and select blood pressure measurements. A menu will come up, and go ahead and select 3 minutes. You can hear the blood pressure cuff come on, cycle on. It will cycle every 3 minutes. Next, we want to apply the EKG leads. EKG leads are here. And when we place it on the patient, we want to do the white lead to the right side. So white lead on the right side, black and red stay on the left. Just like so. And if you need the buttons for EKG, it will be on the top drawer. Actually, the second drawer. Second drawer will be right here. EKG leads. Connect the button, peel, and apply to patient. This is the operating room bed. The operating room bed is electrically activated. The power source is down here. The plug goes into this opening right here. And you must make sure that the plug is in to utilize the power from the wall. It does have a battery, but sometimes it does not function very well. So it's not recommended that you rely on the battery only, especially in emergency situations. Next, the bed is operated by this remote controller. This remote controller has lights on it that indicates power is on. This is an on-off switch. To turn off, press the red button. Turn on, the on button. If you do not see this light, that means the bed does not have power and is not able to be maneuvered. Next, you want to look at the next set of controls. This controls the locking mechanism on the bed. If the bed is locked, that means it cannot move in this room. So, if the bed needs to be removed for positioning, you have to depress the floor lock. Once the light is on, then you can change the lock and unlock mechanism. Depress the unlock. You'll hear the hydraulics work. All right, back to the controller. This is a remote controller, and using this, you can elevate the bed and you can lower the bed. That is as low as you can get. Those are the two main controls that you need. If for some reason this remote controller does not work or is malfunctioning, you can go and do this manually. On the side of the bed, on the right side. Let's go and see. Here down at the main stalk of the bed, there are some manual controls. And you can do Trendelenburg. Again, this is manual control. You have to level it on its own. Next, you have height. You can raise the height. Lower the height. And you can increase the angle of the back. Again, you have to manually set this back to level. Now, on these beds, there's two arm boards that are placed. The arm boards have controls that normally will not rotate outward. If you do need to rotate outward, there's a lever down here. This particular lever, when you pull on it, will release the lock at the base of this arm board, and then you can rotate freely this way. The lever is here, just underneath the arm board, and it's right here. You have to pull out this way to effect an unlock to freely rotate this arm board. Again, it's down here, just at the tip of the arm board, right here. Let's look at the other side. Now it's locked in position. It cannot rotate any further. On the left side, same thing. To place the arm board onto the bed, you need to lift up this mechanism, and then you can lift up the whole arm board. It has to rest on this rail. It has to clip the top part on the rail and then sit completely on the rail, and then release this lever to lock it in. Now the arm board is secured. This arm board is resting on this pedestal, and there's a locking mechanism right here, which is unlocked if you look at the arm board all the way to the end. There's a lever. It says unlock by pulling this lever. So, like I showed you on the other side, pull this, then you can freely rotate this arm board. Alright. And that's a brief presentation of this operating room bed. The crash C-section kit resides under the operating room light switches right next to the fire extinguisher on a cart that's clearly labeled crash C-section kit. Whoever is available in the room must open this kit for the obstetrician to begin surgery. Do not wait for the surgical team to arrive to perform this task. In a true crash C-section, when no other resources are around or available, it would be just a splash of betadine and lidocaine injections to numb up the skin to get the baby out. Once the baby is out, resuscitative measures can begin. Advanced preparations in these details help improve how we navigate through these difficult and stressful situations. Thank you for your attention, and thank you for what you do.